The report was commissioned by the Ministry of Agriculture following devastating outbreaks of animal diseases which were damaging to various sectors. The task team investigated the ability of the country to diagnose animal diseases on time and the preparedness of the country in putting in place realistic and scientifically justifiable remedial biosecurity measures. It found that the country was failing at these tasks. The report identifies 6 core problems, as there being no clear chain of command, lack of transparency in the policy formulation of veterinary operational policies and procedures, lack of contingency planning, and no timeless communication of critical interventions. Role players say it's critical for the country to have efficient systems to prevent and manage animal diseases, as maintenance of animal health is important to support inclusive growth and job creation.
I was interviewed. What we expressed is that, we needed to be able to respond to diseases, to outbreaks, and to find a way that we reduce the risks of it happening again. So, in broad, we supported, the investigation. We thought it was necessary. So we were fully in favor of this task team being put together. I would imagine, informally you've spoken to some of the other livestock industries, and I think we all share the same concerns. We all believe that if we're going to grow agriculture and include, people who haven't been in agriculture before, who've got aspirations, that the only way to do it is with a healthy, stable herd where the economics of livestock production are predictable, because, banks and institutions aren't going to loan money where they see high risk.
Red meat producers say livestock farmers and producers get impacted by regular disease outbreaks as business operations stop due to quarantines, and this also affects prices. The organization says it's ready to play its part in implementing the recommendations.
We are prepared. We are ready to run with this and do our part, and where we must do our part. What I'm worried about is government ready for this? And we must have a meeting with every role player. And there must be said very clearly whose job is whose job. And then we must, each other must help everybody accountable for what they must do. That's the only way it's going to work. But from the private side, private enterprise side, we are ready to run.
The poultry sector says it has found that currently most wild birds in KwaZulu-Natal, Gauteng, Mpumalanga and the Western Cape are positive with the avian flu, posing a threat to the poultry sector. There is, however, an outbreak at a company in the Western Cape affecting about 1.2 million chickens. The sector says there are biosecurity measures being taken to cap transmission, but they are also looking into vaccines against the avian flu.
This disease now is endemic, meaning that it is probably a disease that we can't contain by a stamping out policy. It's a disease that used to come in, appear in incidents. Now it's problematic. It's all the time. It's everywhere in the world. It's in the European Union. It's in the USA. It's in Argentina. It's in South Africa. So it's a disease that's creating problems for us. But having said that, we are currently investigating the possibility of vaccination against highly pathogenic avian influenza. And it will still take us a year or two. So the vaccine is not going to assist us in this outbreak. And the reason that it takes a long time before vaccination is done is because of technical issues that we have to address relating to the vaccine itself. Because when you vaccinate, the bird can shed the virus, and the virus can get into the environment.
The report recommends that, amongst others, in the short term, there should be a meeting between the minister and the MECs of all provinces to discuss interim measures to establish the chain of command, allocation of funding, movement control, and the designation of responsibilities. It also says government should urgently establish an animal health biosecurity plan, which should include alternative options to ensure biosecurity, such as vaccination to control the spread of diseases. Gloria Safako Mosi, SABC News, Johannesburg.